Hello everyone, I am Maria Victoria Martirez and I will be presenting Kyphoscoliosis. For our presentation outline, we will be discussing these topics and expect pop quizzes per right after discussing each topic. First, what is kyphoscoliosis? It is a deformity of the spine characterized by abnormal curvature of the vertebral column in two planes, which are the coronal and the sagittal planes. First, let's talk about kyphosis. What is kyphosis? This affects the coronal plane of the body. This is the opposite of lordosis, which is the inward curve in the lumbar spine, while this kyphosis is an exaggerated forward rounding in the back, which are common in older women. Second is the scoliosis. This affects the sagittal plane posture of the body. It can be either S or C shape depending on its curve. Now, for our pop quiz. What are the two thoracic deformities combination that causes kyphoscoliosis? Timer starts now. The answer is kyphosis and scoliosis. And for the pathophysiology of the lung with the patients who are having a kyphoscoliosis, first is lung restriction. This is due to the decreased lung compliance because of the chest wall is impaired, which prevents the more inflation of the lungs. While compression, this is due to thoracic deformity. Mediastinal shift. First, what is mediastinum? It divides the different organs in the thoracic cavity. That is why, for example, if the curvature was in the left side, therefore the mediastinal shift to the left because the organs fill the remaining space in the thoracic cavity. Next is mucus accumulation. Throughout the tracheobronchial tree, where the accumulation of the secretions are difficult to release kasi dun nga naiipon yung mga phlegm sa tracheobronchial tree. Next is atelectasis. This is also present where the areas of the lungs are compressed. That is why respiratory failure is common reason of morbidity and mortality in the patients with kyphoscoliosis. Now let's move on in etiology and epidemiology. Let's move on about this. This mostly occurs in adolescents during puberty. For examples, males have a longer body than the females. That is why yung hips ng mga female is mas mataas and the male mabababa. It also rarely develops in adults unless the condition started in childhood and was not diagnosed or treated. If it develops in adults, then it is from a degenerative joint condition in the spine. It usually occurs with the patients who are 50 years old and older. Furthermore, there are idiopathic occurrences of kyphoscoliosis where the exact cause is unknown, but it is suspected to be caused by genetic factors. Did you know that adolescents are the age group that are mostly likely to develop kyphoscoliosis, including male, because males have a longer trunk than females? Next, what are the possible causes of kyphoscoliosis? First is hormonal imbalances. These are due to stress, eating disorders, and endocrine problems, such as thyroid-releasing hormones, which secretes growth hormone, which are present at young children or teenagers. Next is trauma, for example, car accidents, fall. Next is extraspinal contractures. These are characterized by limited joint range of motion and deformity. Next is infection involving the vertebrae. such as osteomyelitis caused by bacterial or fungal infection after spinal surgery. And lastly, metabolic bone disorders such as rickets, osteoporosis, joint diseases, and tumor. Next, let's move on to the commonly associated with the following conditions like first is neuromuscular scoliosis. This is caused by poor muscle control, muscle weakness, or paralysis because of disease such as cerebral palsy, muscular dystrophy, spina bifida, or poliomyelitis. While the idiopathic scoliosis, it is the most common cause of kyphoscoliosis for about 80 to 85% of the cases appearing in a previously straight spine. Did you know that neuromuscular scoliosis progression of the curves occur more frequently than idiopathic scoliosis? The progression most likely often continues into adulthood, and the long-term effects of the spine deformity can cause the patient disabled, such as losing the ability to sit. In this case, surgery and stabilization are both needed. And lastly, the congenital scoliosis. It is the malformation of the spinal column. The vertebrae fuse together. The bones do not form properly. For surgical treatment, it may be needed at a very young age, and if it is left untreated, this could lead to paralysis of the lower body. These are the three types of idiopathic scoliosis in children. First is infantile scoliosis, from the word infant, infantile. It is a curvature of the spine develops during the first 3 years of life, while juvenile scoliosis for young children, it is a curvature occurs at 4 years of age to the onset of adolescence. And lastly, the adolescent scoliosis for the teenager. It is a spinal curvature develops after the age of 10. It is also the most common scoliosis. For the relevant findings during assessment, for the laboratory findings, there is an increased hematocrit and hemoglobin and hypochloremia. Hypochloremia is a type of electrolyte imbalance which may indicate to low levels of fluoride in the blood, while the hyponatremia, it has the high concentration of the sodium in the urine, which makes the urine more concentrated. For the physical findings, the patient may have increase in heart rate, respiratory rate, and blood pressure due to the abnormal lab values and deformities. While cyanosis, this may be cause of lung restriction, compression, mucus accumulation, and atelectasis that makes the oxygenated blood didn't reach the distal extremities, which can cause the digital clubbing. Next is the peripheral edema. This is caused by the hypernatremia, which causes the lower extremities to swell or yung pamamanas. Next is the venous distension. One of these is the JVD, or also known as the jugular vein distension, due to the increase of heart rate and blood pressure. And lastly, the cough and sputum production that could lead to mucus accumulation in the tracheobronchial tree. These findings will be diagnosed by performing physical exams, X-ray evaluation, curve measurement, and the medical history of the patient. For the treatment in floor therapy, there will be depends on the cause, location, size, curve, which may know in the physical assessment, and growth spurt. In what age group does the patient belong? Is it infant, young children, adolescent, or adult? For young children, it requires observation check-ups that are scheduled for 3 to 6 month intervals. It is considered as small if the spine curvature is less than 20 degrees, while it is considered a serious case if the spine curvature is 25 to 30 degrees. In that case, our first line of defense is brace device. These are the example of spinal brace. First is Boston brace. Second is Charleston Brace and Milwaukee Brace. First, let's talk about the Boston Brace. It is also known as low-profile underarm or thoracolumbo-sacral brace, composed of plastic that is custom molded to fit the patient's body. It is worn for about 23 hours a day. This will depend on the patient if he or she wanted to increase the progression of the large curves at a mean of 9.8 years after bracing is discontinued. Next is Charleston Brace. From the word part-time brace, it is only used for 8 to 10 hours a day during at night. It is worn during the night because the human growth hormone is high during at night, but this is used only by the patients who have the curve within 20 to 40 degree range. And lastly, the Milwaukee brace. It is also known as cervico-thoracolumbo-sacral orthosis, used for high thoracic mid-back curve, a full torso brace with a neck ring that serves as a rest for the chin and for the back of the head. But this Milwaukee brace is rarely used as of now due to its physical appearance. These are the other treatment options for the person who is having a kyphoscoliosis. First is surgery, such as spinal fusion and rod instrumentation. And for the prognosis, it depends on the type, cause, and severity of the curve. That the more severe the curve, it is likely it will get worse. For the people who have mild and moderate scoliosis, they can use brace and some requires monitoring. It can be severe because it can cause changes of the position of the heart and lungs in the thorax, which increases the mortality rate of the people who are having a kyphoscoliosis. One causes is cor pulmonale. What is cor pulmonale? Kasi heart failure mostly occurs on the left side of the heart, but cor pulmonale is located on the right side of the heart due to respiratory distress, wherein the pulmonary artery is connected at the right ventricle, which increases the pressure that causes the heart to enlarge due to more workload. For those who do not have congenital scoliosis, you can prevent kyphoscoliosis or scoliosis itself by doing physical therapy, exercise, and good nutrition. These are my reference. I think that's all for now. Thank you for watching. Please like and share this video for more infos about kyphoscoliosis. Bye.